Hi everyone, welcome to Module 3 of the Living Well with Cancer-Related Fatigue video series. In this video, you're going to hear from Ed and Sandi about how the stress of cancer and other life events impacted their emotions and levels of fatigue. You're also going to hear from Laura, who is a clinical psychologist with CancerControl Alberta. She's going to share with you some tips and tools to manage your stress so that you can keep it from negatively influencing your life.
The first two surgeries, I think I recovered quite well. They were successful, and I recovered well. And then I had the third reoccurrence, and then the treatments. That was a brand new story for me, and it was hard and difficult. And that's when I needed help emotionally and mentally. We had to retire from the farm. We rented it out, and we finally got to the point where we were going to sell the farm. We started looking for a condo, and all this was changing, and we moved. I think a week after my treatment, we moved away from the farm into the condo, and that was strange. And I think I told Laura a couple of times, I think I'm getting depressed. She says, no, I don't think so. You've never been depressed. I don't think so. And I think in the end, she finally says, go get help. And I did. I think some of the things that made me realize that I was depressed was my thinking, my attitude. I was more critical. I was more anxious. I was scared, and maybe angry. And those were all feelings that I normally wouldn't have. I talked to a counselor, and they were amazing. I did not know exactly what was wrong, but I think I finally diagnosed that I was depressed and I needed help. And that was probably the best help I got. Probably the seventh or eighth time I went to the session, I was looking forward to it. They were giving me hope. Even though we're diagnosed with cancer, it's not the end of the world. We still have to continue living, and we still can enjoy life, and we need to make changes and enjoy that. And when you don't know what to do, then ask for help.
I tended to really overthink and overworry, and I didn't see him that often. I wasn't one of those patients that's always in at the doctor, but I guess he just made that decision that he knew that this was going to be a really stressful. And he said, we don't know what's going on, but the bottom line is, even the uncertainty, I can already see you're not feeling emotionally well. And I said, sure, let's do that. Let's go ahead. I hadn't really ever taken anti-anxiety or anything like that. And it was the best thing he did. For me, stress, depending on the degree, looks like anything from starting to be short of breath to kind of having that little prickly feeling all through your body, like that sort of adrenaline rush of, oh, what am I going to do now? Stress definitely gives you fatigue too. I think it pushes the fatigue. I've had 4 friends pass away in the last 2 years of cancer, and I didn't know how that was affecting me or hitting me, but then I realized it actually was kind of stressing me out. It was upsetting, of course, and I had more kind of fatigue going on around those events and those times. Meditate, and just getting that breathing, going back to breath all the time, and just calming down without someone saying, calm down, just teaching yourself how to do that. Now I'm very comfortable about it, and I don't have a lot of sleepless nights. I'm up a lot, but I'm up momentarily, usually just to run to the washroom. And I think the more, of course, I'm doing that, the more it's making me feel peaceful about, and my body is healing. I'm giving it all the sleep it needs. And insomnia is really emotional. It's really easy to get through that. You just kind of have to let go. I've been doing most of my meditation, even for 2 years, in bed in the morning. When I'm just kind of getting going, and always at night to go to sleep. The more you do it, the more you kind of want to do it. Like if you could sit for an hour or two and be a monk, maybe. Because that's why, the more you do it, it comes to you easier. The more you do that breathing, it comes to you faster. You can calm down a lot faster in stress. And again, I had no idea. I was like poo-poo with my sisters in their meditation. Like, it's been a life changer. Really, for me, just learning meditation, learning the breathing and understanding it, has just totally changed my experience with being diagnosed with cancer and how I respond.
My name is Dr. Laura LaBelle, and I'm a clinical psychologist working in Alberta, supporting patients and family members as they go through the cancer experience. So Ed's story really rings true for me from a clinical perspective. As I see patients in my office, very often they're coming for support because they've had not just cancer to deal with, but also all of the life changes that come with it. He had to leave everything behind, his farm, his community, his family members who lived in that area, and come to a different city for his treatments and for his recovery process. It means that Ed was going through a lot of changes at once. So his very foundation probably felt rocked. A range of emotional experience is very normal. So within a minute or a day or a week, you may experience anything from anger to fear, worry, feelings of hopelessness, helplessness, positive feelings as well, such as joy or gratitude for the support that you're being given through your experience. I think it's really important also that people practice being gentle with themselves as they notice their unique stress responses when confronted with this stressor, because you're just doing the best that you can, dealing with a very, very difficult situation. But it doesn't mean that there aren't things you can do to help yourself a little bit better. One of the approaches that can be most helpful at the beginning is some planning and problem solving around the ways that life has changed and what can I adjust in my day, in my schedule, in a practical way to help take my load off. It can be very helpful to think about what can I control right now in my life? What is beyond my control and do I need to accept or let go of? And what is it that I can actively do to contribute to my quality of life? Mindfulness meditation is something you can practice when you feel like you can't do anything. It's something that you can do. And in fact, a large body of research supports the application or the use of mindfulness meditation in managing stress associated with cancer. So mindfulness is a way of being in the present moment, right here, in the present, rather than worrying about the future or rehashing the past. It's about being right here. In terms of your sleep, there are some things you can do behaviorally, and that means in terms of actions you can take that can help you get better rest. So the most important thing right off the top is probably just to go to bed at the same time every night and wake up at the same time every morning. Have a bedtime routine that is consistent. So when you get ready for bed, make sure that you do things in a similar order each night and have some activities in the hour or so before you go to sleep that are relaxing, that aren't too stimulating in terms of activating your mind. So I think the most important thing is if something is bothering you, if something is hard to deal with, like fatigue, like stress, talk to people about it. So talk to your doctor about it, your oncologist, talk to your nurse, ask them for their advice, ask them who you can talk to. I think if there's one thing that I'd want people to remember as they're coping with stress and coping with fatigue, it would be that you're really dealing with a significant stressor, and it's important to be gentle with yourself.
I like how Ed's story really illustrates that often it's not just cancer that causes stress in your life. He talked about how selling the family farm and moving into the city, in addition to the cancer diagnosis and treatments, all contributed to making him feel depressed. Sandi talked about how she can feel when she's getting stressed and how she uses mindfulness meditation and some anti-anxiety medication to help her control it. What's most important, though, is that both Ed and Sandi asked for help from their healthcare team and their peers. Laura talked about recognizing and focusing on what you can actually control. She also mentioned using mindfulness and getting enough sleep to help decrease your stress and keep it from contributing to your fatigue. Ed, Sandi, and Laura show us that you can still live well despite the difficult emotions that a cancer diagnosis can bring. So that's it for this module. When you're ready, feel free to watch Module 4 about being active. See you later.